So the virus came to family medicine even before it came to the rest of Pakistan, I feel. There were people coming from China who were not the Chinese corporate clients that we had, but others who were working here. And because AKU was one of the was the first private institution to make the rapid PCR, many people who were returning from abroad came to us for screening and testing. So the numbers continue to grow and grow. When we started doing the screening and testing at the Community Health Center, it was decided that we needed to stay open 24/7 at the CHC. There was one day when we had screened about 800 people and tested about 300 of them. And that is the day when I think everybody decided that this was getting really too big, too large for the small setup that we have. So creating the screening and testing zone was really an amalgamation of everything that had happened in the Community Health Center, creating a safe space, learning all the infection control policies and procedures to make sure that the employees who were going to take care of the patient remained safe. I think everything really came together when we started the CSTZ, and I think it has worked really well, and we were able to serve so many people through it. And I was blessed with an amazing team. We said, this is what the institution wants from us, and can we do it? And everybody said yes. And I think that positivity of the entire team is what helped me in getting where we got. So trust in your own capacity, trust in your team, and know what they can do and take on. The goal was never that we will do it perfectly from day one, and just the ability to be nimble with that was really important. And so every day was a new challenge, and we would sit down and work on it and say, okay, we mastered this one, let's go on to the next one. And I've always found that when you work for an institution or you work for a place, you give it your very best. I actually have this rock always with me. This was given to me from a very dear friend when I was leaving Brown, and what it says is turn it over, and what that means is you do your best, you put in your utmost, and then you just turn it over to fate. We are so busy in working and getting things done that we forget that you need to appreciate, you need to be able to say thank you, you need to be able to say good job. And I think that goes a long way for each one of us. Even you can be the highest leader, but hearing that from whoever is above you really makes a difference, and even from your colleagues. I think as an institution we have all learned a lot from this experience, and what we now know is that there's going to be a new normal. We have created systems and policies of how do we ensure that the patients who may have symptoms of COVID are separated from those who may not have symptoms of COVID. Those little things to ensure that we are going to not only take care of you at the first level, but at every step that you come into the system. I'm really proud of the work that we have done together as an institution. I think this has been one of our best moments. We have not just taken care of ourselves and the patients who come to us, but we've also gone ahead and partnered with the government, partnered with NGOs, partnered with anybody who needed our help, and give the best of us to them to help take care of the country.